to demonstrate now the use of the pad kit for the Sammons Preston R-Flex knee CPM. The standard pad kit for this is 4 pieces in a plastic bag. The 4 pieces you have are the booty for the foot portion, 1 circumferential strap, and then 2 rectangular pieces. You'll notice one is slightly longer than the other. If you superimpose one over the other, you'll see one is just a couple of inches longer than the other. You'll also notice on this back surface, and you may not be able to see them well with the camera contrast, but there are a number of Velcro strips on each side. Traditionally, most people will put the shortest piece of the 2-piece pad kit, meaning these 2 pieces, onto the CPM, shortest piece down at the tibial end. I'm going to show you upside down the alignment of this at first. We've got a 2-inch piece of Velcro, a 1.5-inch piece, a 1-inch piece, and another 2-inch piece of Velcro down at this end. What you will do is simply undo this Velcro, and I will turn it right side up now, wrap it around the bar, and secure it underneath. Undo the next piece of Velcro, wrap it around, and secure it underneath. I want you to notice that this little crossbar here is in between the first strap I secured and the second one, and now the adjustment knob will be in between that piece and the next point of adjustment, and so on. Now I can fasten this pretty tight, snugging the fabric around the bar of the machine, or I can actually do it somewhat loose, depending on how much of a sling or a hammock effect I want in this padding. I will of course go to the other side, fasten it similarly on the other side, and continue right on down that way. If your leg length adjustment on the tibial end has gone out fairly long, you would attach the last straps as well. If you are working with a shorter stature client, as I showed you on this foot plate that will reverse and go the other way, you may actually just either want to cut off or fold under the excess fabric that you may wind up having there, or you could shift it a little bit closer to the pivot point at the knee axis. The upper leg piece is going to be fastened similarly. You've got 2 2-inch pieces of Velcro, one here, a 1-inch piece of Velcro, and another 1-inch piece of Velcro clear down at this end. This would be up towards the buttocks. So you would once again, this time on the uphill or the patient side, client side of the knee joint, fasten your first of the 2-inch pieces of Velcro. Come to the other side, once again doing the same thing. Continuing on, and once again, this may be something that you either fasten loose with quite a bit of hammock or sling to it, or taut with not much. Your objective would be to try and get the center of rotation of the client's knee joint as closely aligned as possible to the center of rotation on this point of the knee CPM itself. The deeper you can make that knee go, the more easily you may accommodate that, depending on how large of a knee that is from front to back. You will have one more piece of 1-inch Velcro that would go right here on the downhill side, so to speak, of the adjustment knob. And depending on what you've done for length, you may or may not wind up using this other piece at this end. Swapping end for end on this, or even swapping this piece for this piece, for the most part is not going to matter. You just want to make sure you've got enough there to get the best support possible for the client that's going to be using this. You're going to have a gap here at the back of the knee that's actually nice and comfortable for a little bit of ventilation, as well as to keep any bunching up of fabric from happening at the back of the knee and creating some discomfort from that. One of the other pieces of the pad kit is simply a circumferential strap. This kind of becomes a personal preference issue. A lot of people will use it around the thigh as a circumferential strap. And I'll turn this a little bit so you can see, to help hold that thigh in place. Some people would use it over the lower leg, other people wouldn't use it at all. So it depends a little bit on maybe what the surgeon's preference is, a therapist, or even the client themselves. I want you to notice that there's a rough surface on this Velcro. What you would not want to do is have that Velcro part over the top of their thigh, fastened like this for example, and have the roughness of this Velcro, this hook and loop, up against potentially their skin or their dressings. So make sure that that isn't in an improper place, that that's oriented underneath, and then wrap it accordingly so that you get as much circumference as you need, tightening it down as tightly as you need. Lastly, we have the booty. There is an elastic pocket on this booty right here. I'm not sure how well you can see that. That is intended to slip over the end of the foot plate. And then we also have a Velcro closure here that would close over the top of the foot. So if you grab hold of this pocket, this elastic pocket here first, hold the rest of the booty out of the way, slip it down as much as you can over the end of the metal of the foot plate. Once the pocket's in place, then set the rest of the booty down and just lightly tap it in place, making sure it adheres to the hook and loop. And then you have the full pad kit in place.